I came to UT Southwestern because I think the organization and teams that already exist are charting the course from research to improved healthcare delivery and patient outcomes. So how do I fit in? What do I bring? I have 3 roles here. The first is Associate Dean of Health Informatics. Second, I'm the Director of the Clinical Informatics Center. And third, I'm the Chief Learning Health Officer for the health system. These positions were created purposefully to work together and facilitate what's my main objective: to leverage informatics to build bridges between research and practice so that we can become more of a learning health system. I want to tell you 2 stories that motivate my work. First story, a fabulous data science team in a Melbourne hospital created a very accurate prediction tool, and so they knocked on the door of the EMR team and said, "Hey, can we implement this because we think we can help people?" Well, they found out that some of the data elements that they trained their model on aren't even available in the EMR when the predictive model would be triggered. They published a paper, but their model could never be implemented in care. Second story, NYU Lanzhou Health showed millions of best practice alerts in the EHR to prompt physicians to avoid adverse events and promote guideline-based care. They made 19,000 post-discharge telephone calls to patients in an attempt to reduce their risk of readmission. In spite of the investment of people and time for these and many other initiatives, they had no idea whether they worked. My role as Associate Dean of Health Informatics will work from the research side. How do we help researchers think about the end from the beginning so that they design and build their solutions in a way that's more likely to be implementable and adopted? My role as Chief Learning Health Officer will work from the health system side. How can we be systematic but also agile in selecting the best solutions and assessing their value once we implement them? So how does the Clinical Informatics Center that I direct fit into this picture? I've spent the last few weeks in these videos sharing learnings about how the CIC bridges research and practice. They partner with researchers to develop solutions that are more likely to be implemented in our health system, so they're the engine. My approach, then, is to help enhance what works and remove frictions. Indy Johar said, "Success for organizations and systems is less about prescribed end states and more about creating the conditions for change." So how do you get diverse people working together? How do you help people understand and use their agency, adapt quickly, and create shared futures? We'll be doing some strategic planning, but I'd love to hear your thoughts about enablers and barriers to translation of research to practice or to applying a research mindset to healthcare delivery. I've had a lot of one-on-ones, and the 2 biggest themes that I've heard so far are, number 1, this is the place of collaboration. I understand it all started with Donald W. Selden, and he felt the greatest advantage that UT Southwestern Medical Center had over established Eastern schools with great prestige was that it wasn't encumbered by tradition. At the older schools, young professors had to wait their turn, but Dr. Selden and his colleagues told recruits that they could immediately make a name for themselves here. Number 2, we have a lot of excellence here, but we have a lot of silos, and those silos impede our ability to be our best. So my vision is to enhance the enablers and decrease the barriers so that clinicians, researchers, staff, patients, and students can leverage data and technology to address the big problems that we face in healthcare. Together, it will require us to work across boundaries to create new relationships, new infrastructures, and new training. And that's the opportunity that I see ahead of us.